Hi guys, welcome to the structure and function of the cardiovascular system lesson. In the last series of videos that I basically entitled Introduction to the Cardiovascular System, we focused pretty much on the heart. And there were specific things that I wanted you to take away from those videos. In this lesson, I want you to take away everything and treat it like a regular lesson. There is a fair bit of material, but it's not very complicated. I don't think the concepts are all that difficult. And they are fairly basic and they are fairly important. And what we'll be doing is I'll be introducing you a little bit to how, in sort of a global way, how the cardiovascular system works. And then we'll talk a lot about the circulatory elements, the arteries, the microcirculation, like the capillaries and the veins and the venules, the venous compartment. Okay, having said that, let's go ahead and start it. Your cardiovascular system, sort of represented on the left there. And it's one of the three coordinating systems of the body. The nervous system you'll learn largely about in a later block, focusing largely in the central nervous system. The endocrine system you learn about more or less in all the organ system blocks. It's sort of distributed everywhere. This is where you will secrete a hormone, and there'll be the hormone will actually make its way usually into the cardiovascular system, although not always, and then bind a receptor on a target organ and send a signal that way. The cardiovascular system is the transport system, and it's largely involved in the endocrine functions as well, in that many of the hormones that are secreted actually make their way into the blood. But it's also a coordinating and integrating system in that because the blood flows pretty much everywhere, it can easily carry signals and transport molecules from one place to another within the body. That's largely its function. So, the cardiovascular system supplies nutrients. Nutrients are absorbed in the GI tract, and they are carried to the various tissues of the body where they are needed. It removes waste primarily perfuses the GI tract, keeps it functioning, and then it's very intimately associated with the formation of urine in the kidneys, and we'll talk about that near the end of this vital fluids block. It's involved in temperature regulation. You send more blood to your skin when you want to get rid of heat because blood carries heat. And so here, if you carry it to the skin, it can be radiated into the environment and you will lose more heat the more blood you send there. And so it's involved in, it has a role in temperature regulation. And of course, it supplies oxygen to all the tissues. That oxygen picked up in the lungs and the pulmonary circulation and distributed pretty much everywhere else. The cardiovascular system presents a broad general problem in that it has to respond to the activity. It's one system. You're pumping blood out of one heart, but it has to respond to the activity of each tissue and supply what that tissue needs, depending upon what its activity is. If the activity goes up, you need more oxygen. The cardiovascular system has to respond in such a way that that tissue will get more oxygen. Of course, it has to respond to pathology as well to the extent that it can. Okay, so the system itself, you guys know now a lot about the heart. It's two pumps in series, meaning the entire output from the right is received by the left, okay? And it elevates the pressure in the blood vessels. So here are our blood vessels here. We have arteries in this diagram on the left. We have veins on the right. The blood pumps into the arteries, and when you add blood to a vessel, you increase the pressure in that vessel. You blow it up, okay? And that is needed for the cardiovascular system to function. So here we have high pressure as the heart shoves blood into the arteries and increases their volume and therefore increases their pressure. And here we have the veins, which have a lower pressure. Blood flows from the arteries to the veins from high pressure to low pressure. And as it does that, it perfuses the tissue beds, which you see here in this diagram. Okay? And the low pressure veins receive the blood, and that blood is returned to the right heart where it is pumped again. So, this system operates according to Ohm's law. 90% of life is showing up, 90% of the rest is Ohm's law, because Ohm's law describes how things, air, water, blood, electrons, flow. So this is the familiar form that many of you know of Ohm's law. Current is equal to the voltage difference divided by the resistance to flow of electrons, okay? Ohm's law, as applied here, also applies to fluids and air and other substances, and this is another form of it, but you will notice it is exactly the same as this. Blood flow, instead of electron flow, is equal to the pressure difference across the system, pressure in the arteries minus pressure in the veins, divided by the resistance to flow, okay? There's the pressure difference there. Pressure in the arteries minus the pressure in the veins will tell you what the pressure flow was into through these beds, okay? And there is the resistance to flow. That would be, you know, how much are the arterioles in this case, and we'll describe this, providing a resistance to that flow. If the arterioles are small, then it's hard for blood to flow through them, and we say that that means that there's a high resistance to flow, okay? So this doesn't just apply to individual beds, where there's the arterial pressure, there's the venous pressure, and here is the tissue itself. It applies to the entire cardiovascular system as well. So when we talk about arterial pressure as far as the entire system is concerned, we talk about the mean arterial pressure. That is the average arterial pressure over time, and we'll talk about what that means a little bit later. But the mean arterial pressure is the pressure in your arteries as a whole. So, and what you find, at least in terms of large arteries, is that that pressure is in fact the same pretty much everywhere, and it is the mean is the mean arterial pressure, okay? So we talk about Ohm's law. We have pressure 1 minus pressure 2 equals flow times resistance, okay? V equals IR. And in this case, pressure 1 is your mean arterial pressure for the system. How much pressure do I have in the large arteries? Pressure 2 is the venous pressure. How much pressure do I have in the vena cava and the large veins? Okay. The flow through the system is the cardiac output. If I'm outputting 5 liters per minute and I'm receiving 5 liters per minute over here, that means the total flow through the system is 5 liters per minute, okay? Whatever, if the blood comes out, it's split amongst these different tissues, and then it's collected again in the veins. And when it's collected again in the veins, if you add up the flow in all the arteries, it's 5 liters per minute. If you add up the flow in all the capillaries, it's 5 liters per minute. And if you add up all the flow in all the veins, it's 5 liters per minute, and 5 liters per minute gets returned to the heart. So the flow through the system is the cardiac output. Normal cardiac output, 5 liters per minute. The total resistance of the system is the total peripheral resistance. That is, if I take the resistance to flow through all of these little beds and I added, and I determine, I don't add them up, but if you take that resistance and you sort of account for all the resistance in all the beds, you get the resistance to flow through the entire system. We call that the total peripheral resistance, okay? So this equation breaks down to this one because venous pressure is so low it's practically zero. And this is an important equation in cardiovascular physiology. Mean arterial pressure is equal to cardiac output times total peripheral resistance, okay? And it's nothing more than Ohm's law. We just let pressure 2 drop out because it's basically zero. And then, as you know, cardiac output is equal to stroke volume times heart rate. So we call mean arterial pressure a regulated variable. Your system wants to keep the mean arterial pressure as close to normal as possible. So when you monitor blood pressure in a patient, and you say it's 120/80, if it's less than that, then that can be very bad. That's because the system is regulating the pressure in the arteries. So if your blood pressure falls, that means your system isn't able to regulate it properly. There's disease present, okay? So mean arterial pressure, your cardiovascular system, your body, does the best that it can to keep mean arterial pressure constant at a normal level. And it does that by increasing or decreasing cardiac output and total peripheral resistance. And the way that you increase or decrease cardiac output is you change stroke volume and or heart rate. So your body changes stroke volume, heart rate, and total peripheral resistance to regulate mean arterial pressure. That is, to keep mean arterial pressure as close to a normal value as possible, okay? That's the way the cardiovascular system works. All right, mean arterial pressure and blood volume, which we will talk about largely when we get to the kidney, are regulated variables. Your body does the best to keep those at a normal level as possible. It regulates this short term, it regulates this long term, because it takes a while to alter blood vessel. We'll worry about that when we get to the kidney. All the other variables are controlled by reflexes like the baroreflex, heart rate, stroke volume, total peripheral resistance, okay? All right. That is the end of my first video where that's sort of my overview of how the cardiovascular system works on a global level, all right? And we'll continue on with this lesson from here when you're ready. Thank you.